Hello, good evening everyone. Here we have a patient with us. He is coming from Singapore to do some multiple surgical procedure here at Richardson Hospital. So his main concern is he wants his angle of the mandible, that his face to be more chiseled and for manly look, and he also needs his chin to be more augmented, more precise, that will suit for his face. So we are going to do angle osteoplasty and genioplasty for him. Mostly it will be shaving angle osteoplasty to get a more V line for him, more precise V line for him, and genioplasty will be in both vertical and horizontal dimension. Augmentation will be in both dimensions. And third thing we are going to do is, can you remove the specs? Rhinoplasty. Some subtle changes he wants. If you look from the side view, you can see he has a dorsal hump. His dorsum is not straight, it's coming depressed over here and it's coming like this. And his tip, he feels it's little bit droopy, the tip. So he wants to lift the tip a bit up. So it's minimal changes for him for the rhinoplasty. So it's going to be genioplasty, bilateral angle osteoplasty and rhinoplasty for him. All the preparations done. We are going to shift the patient. We will update you the results and we'll follow up the case as well. Thank you.
Chatra. Check.
Slow.
Yeah, that is there. You be slow when you're eating, and what will happen is this soft tissue will adapt even better with time, because now there's still swelling. Once it comes down, it'll look really nice. It's already looking nice, but it'll get even better. We're going to take your nasal splints off now. Any pain on the nose?
I realized that here is like very sensitive, maybe a lot of nerve endings, but
when you touch it,
it's okay.
Okay, we just quickly remove that also. Sorry. Again, there's some swelling. Slowly go. Settle down.
Okay.
Look this way. There you go. So, especially in the side view.
It's like bigger.
Sorry?
It's a bit swelling.
Yeah, there is some swelling.
Very good.
Yeah, and that small hump is gone. Shape has come up.
Yeah, I can see. Think this is swelling here at the tip.
Yeah, because it's about the outside the splint. This is where you put the splint, so that's the place it is. It'll go down for you. You have thin skin, so. And see the angle also. How much more defined it is than it was always nice for you, but we just augmented it by another 3-4 millimeters.
Yeah.
And did you see the scans of before and after?
Oh no, I haven't.
No, we'll show you that also now.
Okay.
Show the scans to him. I've just loaded and kept it right now. I think just check it. All right, you just see the scans and I'll come back to you. It's perfect now. If you see, you know, the
Yeah, it's like, doctor, I really love the way you like precisely the way you even brought it out a little bit just to make it defined. Wow.
Yeah.
Really, I really love your.
Thank you.
The way you did the whole thing.
This was all the motivation that I got from your earlier pictures.
Really? I was so touched the way doctor was sharing that you were putting it there and then you were like working on me while looking at it, like, you know, like doing it there and then?
On the table?
Yeah.
No, it was on the wall.
Oh, on the wall, okay.
So what happens is, if I know where we have to go, then it gives a metabo perspective. You know, because even if you say it's 4 millimeters or 3 millimeters, you know, it's like you have a model in front.
Constant reference.
It's easier.
Correct.
Way easier for me. Otherwise, it's difficult. Then I know, okay, a little bit more.
Yeah.
So because I can make it 1 mm more, 2 mm less, stuff like that.
Minute changes.
So yeah, I can do everything on the table if I need to. I was very happy with the surgery that it came off, and then I haven't actually met and talked with you till then. But I was asking my staff, they said, no, you're happy. Yeah. It's going on
I'm
well.
So sorry, I didn't know you were expecting me in the morning. So I thought anytime I could come today.
No problem. No, that was fine. Just to... And then I saw the scan. So, see, because patient's satisfaction is finally important. Now, you had a very precise desire of getting the angle and the thing back, you know. So that's why this particular procedure we planned, and these are not common procedures. We don't do them for a lot of patients. Simply because people don't have that kind of desire. Everyone had a desire, I would do. But people don't have this kind of desire. They're mostly with the chin and bimax and pie jaws and stuff like that. This is a very fine surgery, and it's also a little tricky one, because you have to make sure that some part of the muscles here are attached, which basically supply this segment, and likewise on this segment. And then the whole, the genioplasty and the thing should be like a new, you see, it's like a new mask at a different level, just coming out fully.
I feel like it complements the rest of my face also, like the upper part of my face.
And for you, it'll really complement. And send me pictures, 6 months, 3 months, okay? And we're going to have a place in Bangalore soon, maybe, and then that time you can come and be a model.
I'm willing to help you out in any way that I can.
Yeah, so when before you come next time, let me know. And that's when I understood what you wanted from after the fillers and everything. And one more thing, nothing was found. Like I said, I couldn't find and take any fillers. Yeah. I told you it's all going to be smoothly blended.
Yeah, what I like is that when you did this, I realized that whatever that I didn't like, got blended and integrated into your work.
Yeah, so now it's come back.
Yeah, so it's like
very, very
almost
happy.
as if it's gone in a good way.
So don't go and get fillers again.
Once bitten, twice
shy. Yeah, forever stuck shy now. Alright, we'll have your number with us, and maybe 9 months, I think is what it is. We'll let you know, and then you can help us a little bit with your skills.